This is what doctors at the Cleveland Clinic hear when a patient develops sepsis. A bold alert for the #1 leading cause of hospital deaths across the U.S., impacting millions.
Sepsis is a life-threatening medical emergency caused by the body's response to infection.
But now, doctors say there's a new tool to help fight it off. It's not an antibiotic or a medical device, it's AI. Just one example of how it's transforming medicine. Here, Dr. James Morrison says, helping identify sepsis faster than ever before.
The patient might come in reporting chest pain or something like that. You're going to be thinking of a heart attack. Sepsis might not be the first thing you think of. While you're focusing on the patient, talking to them about what's going on, and the data starts to come in, the AI can be working on at the same time to say, does any of this fit with a pattern of sepsis?
The Cleveland Clinic, which has invested in this technology, showed us how it works in real time from a digital dummy patient, pulling data like heart rate, temperature, and oxygen levels.
All of those are indicative to us that the patient could have a new infection or sepsis.
Last year, across our system, we had over 30,000 sepsis cases, about 2,000 deaths, and we've seen that our sepsis efforts have driven down those deaths by hundreds per year.
If their tool is like a security system constantly monitoring your body, in North Carolina, a spine surgeon is using AI differently.
It's how I've often described it to patients is it tells me where I am, even though I may not know with my own eyes, just like a GPS in your car would do.
Dr. Brett Rockos at Duke Health says this new technology gives him a 3D view of the patient's spine in real time. Made by Proprio, advanced sensors work to digitally replicate a patient's spinal anatomy. Dr. Rockos says the tool can help shorten complicated hours-long surgeries.
What that means for the patient is they're having less anesthetic, less time asleep on the operating table, less bleeding.
The AI tool is FDA approved, already used in over 100 surgeries, with the company saying more hospitals are now set to test it. Meanwhile, back in Ohio, the Cleveland Clinic will also start testing the world's first neurological AI model that's not trained on text, but on electrical brain waves.
Seizures are storms of electricity happening in the brain.
Dr. Imad Najim runs the hospital's epilepsy center.
Wow.
This is the central monitoring unit. What we're looking at are recordings, brainwave recordings, Ohio, Florida, or even in Abu Dhabi, United Arab Emirates.
You can see people here in the UAE.
Exactly.
Wow.
It's a patient who just had a seizure now.
That
Yes.
voice we just heard.
Yeah.
Monitoring all these screens isn't easy with the human eye, but AI is always on and can more quickly recognize subtle patterns.
We may be seeing something which is difficult to ascertain that it is a seizure or not. Our AI model will be able to detect it as early as 40, 50 seconds before.
Kristen was diagnosed with epilepsy in 2016, but says despite the meds, her seizures haven't stopped. Now she's here looking for answers. They're bringing artificial intelligence or AI into that EEG. How would you feel about something like that?
That'd be really cool. If it's something in as much as it's looking at those patterns to see if it can find like a trace, that would be great. I don't want it to obviously take the role of clinicians who are there to help advise and make like ethical decisions.
And it comes as people turn to AI for medical diagnoses, the next stage of what's dubbed cyberchondria, something experts caution. And the industry is also grappling with how to address strict data privacy laws. But doctors say it can still assist.
Use artificial intelligence to complement human intelligence and using human intelligence to make the final decision.